Let me just... Oh, good.
It's heard my message that we need a wind to blow away the virus.
Okay, I will try to do this with the wind. Good morning, Queensland. I can report 1 new case overseas acquired and in hotel quarantine. That brings us to 1,791 total cases since the pandemic started and 42 active cases in Queensland right now. I'm very pleased to say we've had 25,362 tests in the last 24 hours, which is exceptional. So thank you to everyone who has come out and continued to get tested. And of course, 12,136 vaccines. And we currently have 2,292 people in home quarantine. I can report now that the genome sequencing has come in from the gentleman who came in from the Philippines to Brisbane and who was staying at the Roma Street City Backpackers. What we have identified is he is a direct match with 3 other travellers who he was on 2 flights with, Philippines to PNG and PNG to Brisbane. Those other 3 travellers were sent to a different hotel quarantine than this individual, which confirms for us that this gentleman has contracted it from one of the other travellers while in transit on the plane or through the airports. We can confirm also that it is the Alpha variant that we are dealing with. I want to thank the backpackers because the manager there has been absolutely incredible, provided a lot of data which has allowed us to identify and test all individuals associated with that backpacker. There's 62. We have 59 results back and they are all negative, which is a great news. I'll get Dr. Young to fill in a bit more information, as this gentleman had travelled after he left hotel quarantine in Brisbane. He had travelled to Western Australia, stayed in hotel quarantine for 2 days and then returned. So it's particularly that flight from Western Australia back to Brisbane that we want to ensure that we contact trace because that appears to be the period in which this gentleman started to become infectious. I can also update that we've had 10 people transferred from the Sanyu carrier from Weipa down to Brisbane. We're managing them in our COVID wards. There are 11 still on board, 2 who are negative and 9 who are positive. In relation to our restrictions, with the number of different outbreaks that we have had across Brisbane in recent times, because of what we are still seeing in New South Wales, and that there is still a risk, even though that risk is decreasing Victoria and South Australia, that the restrictions will continue in relation to mask wearing for the 11 LGAs for another week. We know that people were hoping that the mask would lift, but I think we're up to 13 incursions of the virus through different outbreaks in Queensland over the last 6 weeks. We have been able to contain all of these outbreaks to very small numbers. And that is in no small part to the restrictions we've had in place, and particularly mask wearing and people isolating themselves at home when they're unwell, and of course those who are on home quarantine directions. So is it important, while we work through the most recent cases that we've had in the community, that we continue to practice mask wearing to ensure that we don't have transmission going through our community. So we thank everyone for their ongoing compliance for mask wearing. I remind everyone, police will be out checking people are wearing masks. I particularly want to remind people, because I have people contacting me on social media asking me to reinforce this message. Social distancing. So when you're in supermarkets and shopping centres, just be conscious of how close you are to other people outside of your immediate household and show that respect and keep that social distance. And also, we remind people that in those 11 local government areas in Queensland, you must be wearing masks indoors and outdoors unless you are doing vigorous exercise. So please, while you're in supermarkets, shopping centres, you need to have this mask on. Make sure you're carrying it with you at all times. I'll now ask Dr. Young to just update on that particular case and our new case reported today.
So very good news for Queensland, and thank you to everyone who's been complying with all of the restrictions and the requirements to home quarantine. So no new cases in the community in Queensland in the last 24 hours, which is excellent. We do have that whole genome sequencing result on that latest case, the gentleman who travelled from the Philippines via Port Moresby to Brisbane, and it's the alpha variant, and it clusters exactly, no SNPs different, with 3 other cases that we've had here in Queensland. It doesn't cluster with any other cases in Australia. So it's clear that he's acquired it from one of those 3 people. He was on the same plane as those 3 people when he travelled from Manila to Port Moresby, and then again on the same plane when he travelled from Port Moresby to Brisbane. When he arrived into Queensland, though he's unknown to these 3 people, they don't know each other, he went into one hotel and these 3 people into another hotel. So he's clearly acquired it in transit to Queensland. That's important to understand. We then realise that is a longer incubation period than we'd normally expect, but we know that around 1% of people can have an incubation period longer than 14 days, as has happened with this gentleman. Now, when he got out of hotel quarantine here in Brisbane, he'd done his 14 days and had 3 negative tests. He then on-travelled to Western Australia, but they turned him around. They put him into a hotel for 2 days till there was a suitable flight, and then he was placed on that flight and returned to Queensland. So I'm just getting the details of that flight he was on. I don't have them yet, but we will contact trace the people who sat around him, given he's got the alpha variant, and contact trace them. Then when he arrived, he was already starting to have some symptoms. He went to the Backpackers Hotel in the city on Roma Street, but he essentially stayed in his room there because he was starting to feel increasingly unwell. The other 2 people in the room have tested negative, which is good, and due to the cooperation of the manager of that hotel, who's done a brilliant job, and the people who've been staying there, we've now tracked down the 62 people who've there currently, tested all of them and got back 59 results, all negative. The other 3 people were actually out of the hotel when we were in there testing, because no one knew this was happening, of course, and came back to the hotel, and we tested them late last night, so I'll get their results soon as to whether they're at risk. So we've worked with the manager, and we're going to keep those people in the Backpackers Hotel. We're not moving them into a quarantine hotel because we're quite comfortable with some extra support for that hotel. We can manage all of these people there. We'll just have to work out which of them have been close contacts and which casuals, so who needs to remain there and who we can allow to return to their normal lives. So all of that work's happening at the moment. So that's all very reassuring. We still have those other outbreaks that we're managing with large numbers of contacts. So we have a lot of people, well over 2,000, in home quarantine in Queensland today because they're close contacts of one of our many other cases. So all of those are being managed. So it's too early for us to relax at this stage, which is why I have asked that masks remain in place for the 11 LGAs for another week. I think it has protected us from getting further spread out into our community, and we're just seeing so many of these cases pop up from so many different places. So it's important that we all continue in those 11 LGAs to wear our masks, and that if you're asked to quarantine, that you do so, and that when we go out into public, we use those QR codes so that we can very quickly, as we've been able to with this hotel, contact trace people and find people. That all makes a big difference. And then most importantly of all, as more than 25,000 people did yesterday, any symptoms at all, immediately come forward and get tested and isolate till you get a negative result. That's absolutely critical. Thank you.
Wind. Okay, at our road borders yesterday we saw 4,463 vehicles intercepted with 41 turned around. We did see in our heavy vehicle operations, so the freight that's coming into the state, that the number of turnarounds is increasing, 77. The reason for that we've identified is that a number of the truckies are getting the wrong passes, which meaning that we're having to stop them, turn around until they can get the correct pass to come back in, so an F pass. So the message to all our truckies out there is please get it right before you come to the border. We didn't have to take enforcement action against anyone. We want them to get through. It's incredibly important that we keep our freight coming into this state. So again, the message out there to all truckies, make sure you have the right pass. You're not going to get through without that. At our domestic flights, we saw 434 passengers processed, so the numbers are down. 5 turned around and only 60 into quarantine. Yesterday we handed out 36 masks, so the message is there, as you've heard. Masks will continue for some time yet. People need to make sure that they are carrying them and wearing them when they're required to. Happily, yesterday we saw no enforcement action having to be taken, and we had 223 international arrivals. Thank you.
Got everyone that overlapped with Jeannette today as the backpackers?
No, I haven't got everyone yet. So we're working through the people who've left the backpackers while he was there. But I'm reasonably confident from advice from his other roommates and others that he spent the time he was unwell in his room in bed. So I think the risk is reasonable, but we do need to find everyone who's been in that backpackers since he arrived back in Queensland on the 20th of July.
You feel you've got those that stayed in the correct?
Oh yes, yes. I am very relieved it's the Alpha strain and not the Delta strain. We know that the Delta strain is a lot more infectious than Alpha, and we know Alpha is more infectious than the original strains we were dealing with. So the risk is just going up. So I'm glad that this is Alpha. It's still a risk, a significant risk, and we still need to track through everyone who's been at that hotel. But I'm confident that hotel has very good records and we'll be able to find everyone. Yeah. Yeah. So they've all had exposure. So we've tested them all and they're all negative. We'll be testing them frequently, more frequently than the day 1, 5, 12, because we're confident we can manage it there. And police are working with us to make sure it's a secure site so people aren't going in or coming out who shouldn't. Yes, yes, we'll support them. So we're providing food and medical support, health support, yes. Yep, I think GPs should do that. It's easy to purchase them. Anyone in the community can go out and purchase the N95 masks. I've done that myself. So GPs, yes, of course, they should be looking at purchasing N95 masks or P2. No, we don't normally provide PPE to GPs. They're private businesses and they would normally do that themselves. Now that there's enough stock. When there wasn't stock and it was really hard to get even these masks, then of course we are working with the Commonwealth who were providing PPE via the public health, the primary healthcare networks. So Queensland Health wasn't providing that PPE, the Commonwealth Government was. Yep. Yep. I mean, if people are concerned, if they think they're going to a high-risk situation, then of course they can purchase those P2 or N95 masks. But I think these are pretty good because they do more than just protect you. They also remind people that you should be keeping a bit of distance, to be a bit careful. If you get symptoms, go and get tested, all of those other things. So they're a really good strategy. Yeah. Right, I received a formal response from the NRL late yesterday, and I'll be responding to that today, but there were some mitigating circumstances for that individual. So I'll work that through with the NRL. Yes, it will. Yes. Yeah. Yeah. There's not much we can do in our hotels to mitigate that risk anymore, other than go ahead with those new environments. So hotels that have outdoor access and don't access into a corridor. That's really the next step. And as people are aware, that's what the Queensland government has been asking for many, many months now. We have looked at CCTV footage. We really can't see that there's any obvious breach that has led to that infection, but clearly genome sequencing shows that there has been transmission.
No, but that wouldn't, at this point in time, come to me. Where Queensland Health would come into this, obviously at officials level they're working with other agencies, but at this stage it is once they start developing the plans, we already know what we want from a health perspective, which is that, as Dr. Young has said, they've got direct access to the rooms externally, so not closed in corridors. So we've seen that at Howard Springs, for example, that they're, for better words, dongers or demountable buildings with open verandas on them and direct access to each room. So that's the sort of thing we want. We would then work out what sort of facilities as far as healthcare. Some of the key things we've looked at all along is we'd want the staff residing there. Because if staff are leaving and going home each day, it's a similar risk to what we see in hotel quarantine, in that if someone was to contract it, then they're taking that out into the community, where if they're residing while they're working, and that's why regional quarantine was such a good idea, because they're residing on site. If there was any sort of transmission, it's contained to that site and it can be controlled. All those details would have to be worked out, but a lot of this would be done with state development and with Department of Premier and Cabinet first, and then we'd be working with them about what the health requirements would be. No, 6th of August. Yes. Not that I'm aware of through our hotel quarantine, no, because what it really is requiring those sort of demountable buildings that have verandas that you can walk along and no corridors. We're using standard hotels where you're going up in a lift, you're walking down a closed corridor and you're entering into hotel rooms. We've been using them for almost 18 months. They've worked extremely well for us. We have continued to improve. Every time we've had transmission, we have reviewed, we've learnt and we've improved our processes. But there comes a point that there isn't too much more you can do to reduce the risk. You can never make that risk zero. And the only way you can, because what we've seen time and time again across the country is most of this transmission's happening through the air, through doors opening and it getting into the corridor. Time and time again, that's what we're finding is the cause of the transmission, not because anyone has done any sort of deliberate breach or accidental breach in their conduct. It's just the transmission through the air. And we have limited ways of avoiding that unless we have rooms that open up into open air. Look, I haven't heard that. I'm happy to see the detail, but there's a lot to work through. There is a lot to work through on how this would occur. Whether the buildings are suitable. I understand they're very old buildings. This isn't new demountables. They're very old buildings. So there's a lot of detail to work through. even if it is the end of the year, it's better than nothing, but it's still the end of the year. Every day matters when you look at this virus. Every single day. It was only 6.5 weeks ago, if my numbers are right, that we had one case in New South Wales from a limousine driver. One case, 6.5 weeks ago. And that has turned into over 2,000 people. About 11% of those people are now in hospital. A third of those people are in ICU, and a number of people are on ventilators. So that all came from one case over 6.5 weeks. So when you talk about something might or might not be built in another, 5 months' time, that's a lot of risk still.
Have you received any preliminary findings from
No, because what is important is the final outcome of that report, and that's what I'll await. There's no point in getting preliminary findings at this stage. Remembering this is not about how the virus transmitted. This is about whether this individual should have been deemed to be part of the 1A group, requiring this person to be vaccinated or not because of where they are working. That's what this investigation's about. It's not an investigation on how did it transmit to this person.
Have there been any findings as to how that virus was transmitted to that?
I haven't had an update at this stage on that transmission.
No, because she didn't go into that ward and that gentleman didn't come out of the ward, but whole genome sequencing shows she got it from him. So possibly it might have been one of those very, very rare instances of fomite transmission, but it's hard to understand how it happened, but it did happen. So, well, we can't, we've thought it through, we've looked at it, and we can't think of any way that it's happened. We tested all of the staff, none of those were positive. So of course we've reviewed it. We always review every single time there's a transmission event that occurs and we can't find anything. Pardon? Yes, we've been working very closely with them, and we've got a whole lot of contingencies in place depending the situation we're at in Queensland when the ECA starts.
Will there be extra beyond just checking that everyone will be respectful of the other protocols?
I've got to wait and see. As we can see, every single day something is happening, and there's quite a few days between now and the start of the ECA. But I've been regularly working with the ECA about what they might or might not need to do. So we'll just have to wait and see. Right, so he developed symptoms on the 20th and he arrived on the 3rd, but I'm just getting some more information from WA. They tested him in WA, so I'd actually like to see that full result, because sometimes there's a cut-off when you say a test is positive, so sometimes you haven't met that threshold to say it's positive, but you might have some early signs. So I'm just trying to work all that through at the moment.
Does the incubation period alter the transmissibility, like the longer?
No. Well, I don't know. I don't know what his circumstances. I know he's an Australian citizen, but I don't know where he would normally live or any of those very specific details.
Thank you.
Thank you.